I'm Krista Perry, practice manager for Memorial Medical Group, here with Dr. Hunt from Memorial Family and Sports Medicine, and we're going to talk telehealth. So Dr. Hunt, can you tell us what is telehealth?
So telehealth is really just a HIPAA compliant way that we can utilize technology to stay in touch with our patients during the COVID-19 outbreak without having to bring our patients in person and expose them to the virus and other things.
Walk us through the basics, if you could.
So generally speaking, when a patient calls in, they get our front desk staff, and we kind of determine if it's something that needs to be directed to the emergency department or something that needs to come into the office versus something that we can accomplish over the telehealth platform. And from that standpoint, we then have to figure out if our patients have smartphones or if they're going to use their email address and try to accomplish this with their laptop. And most of the time, most people have a smart telephone now or smart cell phone now, and they can basically just receive a link in a text message that they click on after we prompt them with the message, and then we have a live virtual connection with both audio and video.
Perfect. Who is an ideal candidate for telehealth?
I think there's a little bit of interpretation here. I mean, there's certainly applications for both new and established patients. Some things, like a rash or a medication follow-up might be appropriate for a telehealth visit versus an ankle sprain or something where we need to get our hands on the patient and do an actual exam. So there is a little bit of interpretation there, but there are lots of ways that we're finding that we can connect with our patients through telemedicine and accomplish things like medication refills, how a patient's responding to a medication, even new illness-related symptoms. But I would say that our telemedicine visits don't have to be limited to potential COVID symptoms.
Perfect. Did I hear you say new patients could use telehealth?
Even new patients can use telemedicine. That's something that, with the whole insurance and payer system that they're allowing us to do now is new patients with telemedicine. So, yes.
Perfect. Good. How can I help a patient, or you help a patient, be successful in their telehealth visit?
Yeah, I would say just finding a nice, quiet and calm area of your home where we can, hear you and see you clearly. So a well-lit room is helpful as well, especially if it's something that we need to see, like a skin rash or the back of your throat or things like that. And then just like you would prepare for any other doctor's visit, being prepared with what is bothering you and the typical things you're experiencing.
Perfect. What if I'm not technologically savvy? Can anybody do a telehealth visit?
I would say generally anybody can do one. As long as you're able to hold your phone and you can see your face on your phone, you can accomplish a telemedicine visit.
Tell me why do you think that telehealth, besides just the COVID, it's become pretty popular, especially in our office, as I'm sure it has other offices. Yeah. Why do you think that is?
Well, I think it's more convenient than people realize, and they can fit it into their life pretty easily versus, sometimes it's a hassle to get off of work and drive to the office and things like that. Now, there's going to be some circumstances where that's going to continue to be necessary, but in general, we can get a hold of someone on a telephone or telemed visit for, 5, 10, 15 minutes, and it doesn't inconvenience their life very much, and it's something that we can accomplish pretty easily.
What if someone's spouse or grandma is home? Is it HIPAA compliant, or who can be in the room with us during a telehealth? Yeah,
so our platform for telemedicine is HIPAA compliant. So you are able to have a spouse or family member present. Now, if it's a patient that is a minor, we would ask that a guardian be present for the telemedicine visit, just like we would ask a guardian be present for an in-office visit. But essentially, we would say, just like you're coming in, if you wouldn't want someone to come into your in-person visit, you wouldn't want them in your telemedicine visit either.
Good. Are most insurances covering telehealth visits?
Yeah.
Or am I going to have to pay out of pocket?
No, most payers are covering this, and especially because of the whole social distancing and some of the restrictions that have been in place, shelter-in-place kind of things. The payers have really stepped up to pay for these services because it is one of our only ways to continue to connect with our patients.
All primary and specialty care offices within Memorial Medical Group are utilizing telehealth medicine for both new and existing patients at this time. If you have any specific questions for any of those providers, please contact the office directly.